I want you to imagine this. You're walking in an herb garden on a warm July day. Scents of lavender, basil, and thyme. Or someone you love baked chocolate chip cookies, still warm, filling the room with their aromas. I was born with an incredible sense memory surrounding taste and smell. Simmering pot roast brings me back to my grandma's kitchen 40 years ago. I dream about tropical fruit, roasted coffee beans, perfectly cooked pasta, or sweet, ice-cold, ripe watermelon. Food controls my moods. A good tasting at work has me walking on clouds. Bad one, I shut down, become aloof and depressed. I try to control these emotions, but it's always a loss. I taste food as if I have some sort of ancient wisdom. It's just my way of cataloging memories. And after over 30 years in the kitchen, I've learned a lot about where our food comes from, all the outside influence on our food system. Unfortunately, it's just another business that doesn't always take us into account. My dad, he had epilepsy when I was young. He was unable to hold many jobs because of this, so he had few ways of putting food on our table. He had experimental brain surgery at the National Institute of Health in 1986, removing a lemon-sized piece of his brain. Spent months in the hospital, uprooted our lives. I have vivid memories of the trash they sent him to eat as he recovered. Canned fruit, canned vegetables, food that almost looked like plastic. The surgery was a complete success, thanks to one of his young doctors, Dr. Orrin Devinsky, who now directs the Epilepsy Center here at NYU Langone Health. My dad just turned 70, lives a normal medication-free life tending his vegetable gardens. If you look up commodities, this is what comes up. Commodities, basic raw materials used to create consumer goods, food, furniture, fuel. I have a basic understanding of how the markets work. I was a licensed commodities broker, out of genuine curiosity for everything food. Farmers, miners, manufacturers need a way to trade fairly, plain and simple. Hedge against price fluctuations, especially as crops grow. Beef and oranges are not the same as aluminum and steel. I think we all could see how we would treat them differently. As our food system grew from the small farms and markets to the mega corporations of today, we strayed away from that delicate care you might give to your baby spinach or raspberries. Our food can travel thousands of miles to get to us, and most of us no longer eat seasonally or locally. The fact is, if you treat your food supply like the raw materials on a construction site, you reap what you sow. I was in elementary school in the 1980s. It was the revolution of fun, colorful, packaged, processed food. Breakfast cereal commercials were like Netflix. Professional athletes convincing us we could take on Michael Jordan. Literally anything was possible if we only ate our Wheaties. The microwave was all the rage. Fast and convenience were the buzzwords. It was awesome. And I fell for it all, hook, line, and sinker. But my mom was not having it. She wouldn't let me eat processed foods back when it was all that I wanted. It sucked. My mom taught me how to eat mindfully with very little means. She taught me how to be resourceful, put care into everything in the kitchen. She was growing green beans, lettuces, and herbs, and making us compost long before it was cool. My mom died of pancreatic cancer in 2005. It was grueling. But she lived years longer than all the stats, thanks to one of her young doctors, Dr. John Allendorf, who is now one of the top pancreatic surgeons here at NYU Langone Health. After my mom died, I put my head down and I hid in the kitchen. Cooking in New York City kitchens, it doesn't leave room for anything else. It's all consuming. Anthony Bourdain said, "The professional kitchen is the last refuge of the misfit. It's a place for people with bad past to find new family." My life became centered in the kitchen. It was friends, family, community. My kids grew up poking at fish in walk-in refrigerators, and pastry chef friends baked their birthday cakes. I was incredibly motivated and hardworking. I loved it. I rose up and became an executive chef for one of the most notable restaurateurs in the world. By 2014, I was consulting all over New York City when I was sent here on a menu project. As a chef, cooking in healthcare was not a glamorous idea. Hospital food was a common joke. I was baffled by the state of food in most hospitals. Thinking back to my dad's hospital food trays, it was almost a non-negotiable no. But curiosity got to me. And I was fascinated with Dean Grossman's deep interest and love for all the details of food. This was not the average hospital. It took me a while to commit to cooking in healthcare. I was reluctant to take a full-time position. But I started to collaborate with departments all over campus. I did patient meal rounds, which were quite daunting at first, but so incredibly impactful. You become very used to moving your way around a dining room and connecting with guests in a restaurant. But being able to put a smile on the face of a sick patient is like nothing else I can describe. I didn't know where my place was exactly, but I knew I had found that fire. Helping to heal or prevent disease with what matters most to me, food. It was fate. So we got to work. We figured out how to get farmers into our loading docks. I joined the board of our group purchasing organization so we could help decide what foods are even available for institutions to buy. We approached the novel idea of cooking all of our food from scratch. This was not done in healthcare. We scrapped all the deep fryers and the greasy old menus, and we started tasting food every day in the kitchen. We found antibiotic-free poultry and fresh fish from Restaurant Connections. We ditched all the cans, and we started buying fresh herbs. We haven't even scratched the surface of our plans, but it's a glimpse of what's possible. Our team of cooks find joy in doing their job well, and it shows. We even started a cooking show called Cooking for Wellness on social media. Now I get the chance to ask top physicians questions about diet and nutrition and how it affects our short and long-term health. Their answers are mostly the same. Yes, genetics may be unavoidable, but the rest is up to us, and we have much more power than we think. Our hope is that patients will realize the impact food can have on their healing journey. We can't fix the food system or change the commodity markets, but we will continue to prioritize healthy food, talking, teaching, and advocating, and set our own example that others can follow. What if when we went to any hospital, it was simply normal for the food to be fresh and healthy? What if all hospitals made fresh fruits and vegetables just as basic as the bed, the gown, the IV? How might that affect people's lives? And finally, if we made it just as normal at home, how many of those hospital visits could be avoided altogether? Thank you.